Now to an alarming new milestone in BC's healthcare crisis. CTV News has learned that summer staffing shortages are so bad that in one hospital, ER nurses have been ordered to call 911 when there's no doctor on shift. This comes after another hospital admitted patients without a doctor overseeing their care. CTV's Penny Daflos has more.
Bulkley Valley District Hospital has had a plan in place to keep its ER open without a doctor. This memo obtained by CTV News says family doctors whose patients show up will have to come in on a day off. Unsupervised nurses faced with an emergency would call 911.
You're in a healthcare facility and you're having to call 911. That, first of all, is shocking news to me.
The BC Nurses Union is now canvassing members to see if any have had to call 911 from a hospital.
It's lunacy. It's nothing that should ever happen in the Canadian medical system.
The Premier and Adrian Dix, I would love to hear their explanation for how a nurse in the emergency room may have to call 911 to support a patient.
The nearest hospital to Smithers are at least an hour away. Northern Health says they've now covered all ER doctor shifts but wouldn't let us speak with anyone. Recruitment and retention in rural communities continues to be a challenge. Every effort is being made to prevent emergency department service interruptions in the north, they wrote in an email.
This, I think, is probably happening in many more places than we think.
In Nanaimo, unofficial letters from staff now warn some patients they've been admitted to hospital without a doctor overseeing their care.
We can easily have that perception that, well, once I'm in the hospital, I'll be safe, I'll be protected. But what this letter is telling us is that's not what's happening.
The Doctors of BC says talks are underway as they continue to work at a provincial level for solutions in family practice, emergency medicine, and inpatient care. But multiple physicians tell CTV News they see little progress in solving systemic issues and addressing burnout.
It's absolutely not about money. They've offered ridiculous amounts to cover this shift and that shift, and they still have hundreds of ER closures and inpatient shortages.
It's a collaborative team effort, and if you don't have one piece of your team there, the system is going to fail.
And Penny Daflos joins us now. Penny, we keep hearing about recruitment of healthcare workers, but is that working?
Well, they seem to be losing staff faster than they're hiring, especially in Northern Health. And I keep hearing BC is not as competitive when it comes to wages. The government is too slow to credential foreign doctors and nurses, and we're one of the few provinces without physician's assistants. Bottom line, lots of meetings, but few changes where it matters most, with patients and frontline staff paying the price, Mi Jung.
All right, thank you, Penny.